Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I am your host, Dr. Kishore Volodi, and today we are dealing with a question that comes up quite a bit, including in emails that you send me, but also in clinic visits. And we're going to be talking with Dr. Lina Patel about device use and how do we get folks with Down syndrome, or even just folks in general, to tolerate things on their faces, especially. And so this is going to be a really interesting and exciting podcast for us. But before we get too far into it, Dr. Patel, thank you so much for joining us again. Tell us who you are, what you do, where you do it, why you love working with this population, those types of things.
Awesome. Thank you so much for having me, first of all. So my name is Dr. Lina Patel. I'm a pediatric psychologist. I actually work at Children's Hospital Colorado for my clinical practice. And then I conduct research in Down syndrome at the Linda Cernick Institute for Down syndrome. And so I help them with really looking at cognition and how do we really accurately measure for, cognition specifically in people with Down syndrome. So my whole world is really Down syndrome specific. The treatment that I do at Children's is related to feeding, related to desensitization with wearing medical equipment, with toilet training, with managing behaviors, you name it. It definitely comes up in the work that I get to do there.
Well, those who have listened to the podcast have heard you discuss many of those topics on our podcast. So we are very, very grateful to have you join us again. For this specific podcast, what I was hoping we could address is those of us who work with folks who have Down syndrome, we know that they have a lot of facial sensitivities, things that have to go on their face, like hearing aids or glasses or CPAP masks, potentially. Like that seems to be a real challenge. And I was wondering if you would just kind of address if there is any idea of why is that? Why do we see these types of facial sensitivities more frequently, or do we know anything about that in people with Down syndrome?
I wouldn't necessarily be able to quote research related to this, but I've worked with over 800 people with Down syndrome at this point. So I can probably tell you a lot of things that I've noticed in the work that I've done. Obviously, if the person is successful with using their medical equipment, they're not coming to me. So there's a portion of people who I don't get to see what made them successful. Although I do get curious quite often and will ask families, so what did you do when you were, trying to get them to wear their glasses? If I see someone who is, coming and very successful with wearing them. But the things that I have really seen as problematic are actually like multiple factors. So one is absolutely that, things on your face and the fit really makes you much more aware of the fact that it's there. So there are times, like if you think about, in the general population, wearing glasses and sometimes being like, where are my glasses? And they're on your face. And because you've gotten so used to them being there that you don't even really give it a lot of attention. However, for our kids, because of their facial features, because of how the equipment fits on their face, it takes a lot longer for them to actually get used to the sensation of that. And sometimes it's just not a good fit. So what I noticed with glasses is a lot of times because of flatter facial features, the glasses are like pushed up against their eyelashes. And so every time they blink, they're like realizing that there's something on their face. So for any of us, we would be like, I don't want to wear that, right? Like, because it would be super annoying. Because of the smaller bridges of the nose, we see glasses sliding down, and again, that makes it much more difficult to get used to it to the point where you're like, I don't even notice that it's there. So it's like almost like our kids are just chronically aware of the fact that there's something new happening. And as you know, people with Down syndrome really like their routines. And so if it's something new, it does take longer to get used to. And then if we add all these factors of, I constantly know that it's there, that makes it even more difficult for our kids to get used to wearing those equipment. Same thing with hearing aids. We've seen hearing aids that, it's funny when I'm working on desensitization for hearing aids, there's times where kids will wear the hearing aids and then the hearing aids will literally just fall out of their ear. And it's like, so the problem is not actually that this child is taking them out, it's that they don't fit well. And so we have to be thinking about those things and really, sometimes the audiologists I work with have to do molds several times before we find something that's going to be a good fit. So I do think that sensory piece is a piece of it, but it's also what we, do for everybody, which is we have the chance and opportunity to get used to the sensation on our face to the point where we just don't even pay attention to it. Whereas for our kids, it's just much more pronounced in it because of those facial feature differences. And if it's not a good fit, that's like telltale number one if a kid's not going to keep them on. The other piece is that routine piece. So it's something new and different. So we do see that for our kids, it just takes longer to get used to, and it might be, really small steps, towards wearing them full time. But if we go too fast, our kids are really good at saying, nope, not going to do it anymore. So I always tell families, like, even if they're wearing them for 5 or 10 minutes more, whatever the equipment is, that's still success. And I would much rather do those small steps versus like saying, okay, we're going to try to just wear them full time. And then the child keeps getting into the routine of taking the hearing aids out or the glasses off or the CPAP off. So that's another factor. The other thing I do a whole presentation on this, but one of the other things I call it kid smarts. So our kids really are good at knowing what gets them attention. And what better way to get attention than to take your medical equipment off when you're supposed to be wearing it? So there's a couple of things that I've noticed, but I definitely think that there are factors that make it more difficult for our kids to get used to this equipment, and that we just have to be much more strategic, but kids can be very successful with wearing any of those equipment.
Yeah, we've had, I can tell you from my own personal experience, when my brother was younger, one of the things that I remember doing was ducking because the glasses were going to come flying, and that was going to be a real, I guess it made me more mobile as a child, perhaps ducking and running from glasses that were flying. And I guess I was wondering, like, what are some of the things that you counsel families like to give them the best opportunity for success? You talked about a fit and building it into the routine and things like that. But are there specific like reward techniques that you use or behavioral techniques that you use in order to get this to be more successful for them?
Yeah, absolutely. So, if we think good old fashioned behavioral interventions, we think about how we can pair, use of equipment with something preferred or preferred activity. Some families don't like to do that because they're like, isn't that bribery? And what I will say is for a lot of our kids, they don't understand why they have to use the equipment. And if they don't have a deep understanding, no different for us. We may not like the equipment, but we may wear it because we're like, long-term, it's going to benefit me. For our kids, they don't necessarily have that same realization. So a lot of times we do have to, especially in the beginning, start off with pairing use of the equipment, whatever it is, with a preferred activity. So if it's, reading a book together, or if it's, having time on an electronic device, or if it's listening to music. A lot of times if you pair something with the thing that naturally is going to improve, so if hearing aids with listening to music, a lot of times those things can actually be super powerful in helping kids to wear it even for longer than we thought that they would initially. So I do a lot of pairing initially. So we will do overlapping, right? So listening to music for the time that you have your hearing aids in. And hearing aids are so sophisticated now that you can actually Bluetooth stream music directly through your hearing aids. So what better way to reinforce wearing them?
Yeah.
After a while, you don't want to have 20 hours of, electronic devices or 20 hours of listening to music. So what we do is we do a first then. So it's first, we're going to practice wearing our equipment for a set amount of time, and then you can have access to whatever that preferred activity is. So for some of our kids, like I said, we have to start with the overlap. And then as they kind of lengthen the time that they're using the equipment, then we can add it to the end and have them get rewarded afterwards. I do feel like that's actually one of the best ways to help kids get used to wearing any equipment.
And one of the things that I use just in my general pediatric practice, not even just so much with folks with Down syndrome all the time, but I use it here too. I don't know what your thoughts would be like on a pause play kind of thing. Like when the glasses are on, the movie's playing. As soon as the glasses come off, it's just a natural consequence. Oops, the movie paused. And then when they put them back on, the movie plays. Is that kind of what you're talking about here too?
Absolutely. Especially initially when we're starting with a very short duration of time. Our kids, sometimes they're not even bothered by the equipment, but they'll take it off because it's just not part of what they are used to. So I actually encourage caregivers to sit with their child while they're engaging in that preferred activity, exactly for the reason that you said, which is if you're watching a movie and the child inadvertently takes off their glasses or their hearing aids or the CPAP mask that they're practicing with, without kind of even giving it a lot of like dramatic, attempt, that you pause the movie and you go, oh, we have to put our hearing aids on. And it's not a punishment. It's not like, I can't believe you did that. It's literally like, these things just go together. And so we have to do them together. And you pause the movie, help put the equipment back on, then you start it again, same thing. But I really encourage caregivers, especially during those initial phases, to really be right there with the child, so that, or adolescent, or adult, to make sure that they don't have opportunities to take the equipment off themselves without even, the caregiver knowing.
What about use of other family members? I'm again recalling back to my own past, but I've used this with some of our families in clinic too, which is rewarding perhaps the sibling for the desired behavior that you want your patient with Down syndrome to do, not in a shaming way, but to reward little sister Sally for wearing the glasses or putting the hearing aid in, and then letting the other person with Down syndrome see that reward happening and saying, hey, I want that too. Is that something you'll use?
Absolutely.
Okay.
Absolutely. And I think that, like you said, it's not, again, punitive. It's more like, being really dramatic in your, oh, good job keeping your glasses on, Sally, or whoever the sibling is, right? The other thing that we've actually found really helpful that goes along with that is making things feel like it's just what everybody's doing. So we will get like, the non-prescription glasses for, siblings and adults in the household if they don't wear glasses. And everybody's, again, doing the same thing. And, to me, that's not just modeling, but that's also kind of making it feel a little less like, oh, it's just me that has to be doing this. So similar to the rewarding piece, it's also kind of making it, again, common for the rest of the family members.
I love it. I love it. And I know that one of the things that people listening to today's podcast are going to want to know about is CPAP. So I was hoping we might be able to transition to that. CPAP, for those who are listening, maybe you aren't familiar with it. As we look at obstructive sleep apnea and people with Down syndrome, you can go back and listen to some earlier podcasts that we've done on this topic, but it's very common in people with Down syndrome. We'll get a sleep study on everybody by the age of 4 if we're following the guidelines. And if there is sleep apnea, then they take the tonsils and adenoids out, usually in pediatrics first, maybe some other surgeries, but eventually it might get to the point of having to wear a mask on your face in order to get air that can be positively pressed right through your nostrils or mouth into the airway. And that is easier said than done. I think I've looked at studies, even just in people who don't have any type of intellectual or developmental disability, and it's very, very low compliance rate when we look at using CPAP. So are there specific challenges that you see in our population of people with Down syndrome? And if so, why would that be? And maybe we've kind of touched on a little bit already today, but what do you see as some of the specific challenges for our population?
Sure. I think that there are several. A lot of them do overlap with what we talked about with hearing aids and glasses. But I do think that the number one piece is like goodness of fit. So the masks, again, fitting. And, the thing is that sometimes the prescription or the decision to use a mask is from a doctor that's not necessarily directly associated to the Down syndrome clinic. So families don't even know to ask, like, hey, is there a different mask, or can we look at a different alternative because this mask is not fitting well? So I a lot of times will tell families, like, first and foremost, like, what do you think about how it fits? Because if there's air leaking or anything that provides discomfort, absolutely our kids are going to notice it and take it off much more quickly. The other thing that I notice, again, is not understanding why the equipment is necessary. And I think that is actually a big piece of, again, why, well, we know in the general population, people aren't really great at using it, but the ones who do can kind of picture the long-term benefit. So again, that's a piece that is missing for a lot of our kids. I think that the air pressure in particular is pretty dramatic, and especially because of the level of apnea that our kids have. The air pressure is going to be higher, which means that it's a lot more of a distressing experience than if if they had mild apnea. And so I think that, I notice a lot of kids who do really well with our desensitization to using the mask, but then when we introduce air pressure, it becomes much more difficult. And so we have to be creative in talking to families about things like the fact that there's a button that ramps up the air pressure. And some families are like, really? And I'm like, oh my gosh, I can't believe that, the family wasn't told that. But even towards the end, like that being something where you have time to fall asleep before the highest air pressure is blowing in your face. I have to tell you a really funny story because I feel like I'm a big fan of experiencing something similar so that you can truly appreciate how intense these things can be, not just for our kids, but for kids in general. So my funny story, it's a little bit silly, but I think that it actually helped me really appreciate how hard CPAP is in particular. So for one of the Mother's Day, 1 year for Mother's Day, my family got me a facial, and I've never had a facial before, but I was like, okay, let's try this. So you go into the room, you lay on the little bed, and they blow hot air onto your face to open up your pores. Now, this is like a very, very high stream of hot air that's blowing onto your face to open your pores. I literally was sitting there going, I'm suffocating. And I was talking myself through like, it's okay, you can breathe, just take deep breaths. But I was having these moments where I was like, and then like stopping and taking like these really weird breaths. And I had this like light bulb moment where I was like, oh my gosh, this must be what it must feel like to have air blowing in your face when it's not patterned or rhythmic with like how you naturally breathe. Mm-hmm. Now, I know that that's a silly example, but I like to think about how distressing these things are, because it really gives us more empathy around how slow of a process we need to take with desensitization. Otherwise, what we're doing is we're setting up our kids for failure. If we go too fast, our kids are like, no way, I'm not going to do this. And then our kids, because they're so good at remembering those very stressful moments, it will take way longer to get them back to a place where they're willing to try than if we start slow and kind of ramp up. So that's my little silly story that honestly like has helped me to really appreciate how challenging CPAP in particular can be from that air pressure standpoint.
That's really helpful. And boy, that sounds like torture. I don't know that I would ever want to get that as a gift now after you say that. So what are some techniques that you have seen to be successful to get folks to be able to tolerate CPAP, at least wearing that mask before the pressure would even start? Yeah.
So we always start out with just practicing with the mask. And really, what I've been told from other people is like 30 minutes is probably your max before it kind of gets like humid inside without air pressure and kind of can do skin breakdown, which then becomes a different problem. So really, we have to get to a point where at least for 30 minutes, we're practicing without air pressure. And so we start with a small amount of time, we pair it with a preferred activity, or reward afterwards. And then we build up the amount of time. And I would actually say schedule the time that we're practicing. So if it's like after school, or after daycare or after work, that it's always at the same time. And we just know that we're going to practice during this time. So the predictability actually reduces anxiety as well, about when it's going to happen. And so then we build up pairing that reward with the time that the mask is on. And you can even be in a seated position. It doesn't have to be in the bed if that feels too stressful for a child. And then what we do is then we transition to laying down with it on for 30 minutes. And then the caregiver can take it off after that 30 minutes if they haven't practiced air pressure yet. But I really, 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 this is so important. I absolutely tell families, do not put the mask on after they've fallen asleep. Like, imagine how traumatizing it would be to wake up with something on your face and potentially even blowing air at you. So I always say, like, taking the mask off after the 30 minutes, like if they're laying down and they fall asleep is fine, but don't introduce, the mask while they're sleeping. So then the goal next is after you put on the mask and fall asleep with it, then you can actually start introducing air pressure. So a lot of times I'll work with sleep docs to say, hey, can we actually adjust these settings so that they're really low and not actually where the child needs the air pressure to be, so that we can gradually even get used to that. Because like I said before, because of the level of apnea that our kids have, the air pressure is so forceful that sometimes kids who have even done great with just the mask will immediately reject it once the air pressure starts. So we say, can we just start with a low level, and then once they get used to that, then we can increase it a little bit more, and then once they get used to that, then gradually increasing it. I'm a big fan of doing this also so that we can show that kids are being successful with using CPAP. One of the problems we've come across often is that medical equipment companies will say, if you're not using the equipment, we're going to take it back, even if you need it. And so if a child is like not using it at all, right? Like even if we're not reporting, oh, they're practicing, they're using it, and the data is not coming back that they're practicing it even at lower pressure, we run the risk of not even being able to practice at all. So I always say, like, I use that as an argument with providers too, and saying, I totally get that this is not where we want to be in the end. However, knowing our population, it is so important for us to be showing that progress is being made and that our kids will do way better getting to the point that you're asking them to get to if we can do slow and steady, instead of just assuming that we're going to have to like grid it out and actually do the highest pressure.
That's a great point. Yeah. So anything else when it comes to what we've been talking about today on this podcast? I feel like there's been some really great information that we've been able to share. Anything else that you would want families to know before we would close this podcast today?
Yeah. I think that one of the biggest things that I would tell families is, don't be afraid to be stronger in your perspective and getting curious. So it is okay to ask providers questions about the equipment. It is okay to ask them about adjusting things to make it feel like it's going to be more successful for your specific child. I think that a lot of times, because of the power differential, we think like we can't offer our perspective knowing our child. And I do think that that's really the most powerful aspect that's going to make people more successful with being able to use their equipment. So it's not harmful. It's not offensive. It's not disrespectful to ask questions, and to even say, I think that my child is really going to have a hard time with this. Do you have ideas or suggestions or things that we can do to make this feel a little easier? Or go back to them with problems like the hearing aids keep falling off, or things like that. Because to me, sometimes we don't offer suggestions until the problem is illuminated. It's unfortunate because we're not anticipating those problems, but there have been so many amazingly creative things that providers have shared with me that's out there that I've been able to then share with families just because I've asked questions. So to me, like, that is really critically the most important thing is having a voice and being okay with getting curious about what other options there are.
Yeah, I mean, I think sometimes it can be such a simple thing, like you're saying, the hearing aid keeps falling out. Well, maybe they need to have a different mold. Maybe the audiologist can get involved there. Or the glasses, there's so many glasses frames that are now out there that will fit the facial profiles a little lower on the nasal bridge, not so squished against their eyes, things like that can be, really impactful. And CPAP masks, of course, if they go to a more typical adult sleep center, they may not realize that there are pediatric size masks that might fit this person better. So simple things like that can make a huge impact. I appreciate you bringing that out for us today. Well, Dr. Patel, I really appreciate this. This is fantastic. I know that this is a 2-hour talk that you can sometimes even give at some of the conferences. So I appreciate you distilling it down for us today and joining us today. So thanks again for being here.
No, thank you so much for having me. It's always fun chatting and being able to share what I've learned along the way.
Awesome. Well, to our listeners, if you'd like to learn more about this or any other topic, Dr. Patel is a frequent speaker at the National Down Syndrome Congress Convention, which is coming up in Orlando here in just a couple of months. So you can go to that website and you can learn all you would want to know about this topic, even in more detail if you come to that. For our listeners also, if you'd like to have us address any topic you would like, please send us an email to downsyndromecenter@chp.edu. I read all those emails and I'm glad to find speakers volunteers that can help to answer questions such as the one that led to this podcast today. And if you'd like to join us in what we do at the center, please go to givetochildrens.org/Down Syndrome Center, and we'd be glad to partner with you in that way. But until next time, bye-bye.